If you talk to cybersecurity professionals in general, I think one of the things that you'll notice is this notion that it's not if, it's when. A lot of institutions are just waiting and expecting some form of a breach. In some cases, institutions assume that someone is already on their network. A threat actor is there and waiting, and it's just a matter of time. And really, the same capabilities that are helping us augment our systems and really augment healthcare in general are available to threat actors. So they're augmenting their platforms as well. They're getting faster, phishing is getting more sophisticated. They're able to launch a multitude of attacks concurrently now. So things that used to take hours and days are taking seconds and minutes now. So I think one of the technologies that is going to be paramount for our survival in general is AI. It's essentially having our front line be empowered by AI agents that can respond to this onslaught with the same speed.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals, enabling them to improve care delivery through integrated design and technology innovation. My name is Greg Malkery, and joining me is my co-host Keith Washington. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, then you're in the right place. Let's explore together what's possible when we go beyond the blueprint.
Today, we're excited to explore healthcare cybersecurity with a focus on how healthcare organizations like Henry Ford Health are navigating the challenges in protecting sensitive patient data while leveraging emerging technologies to secure the future of digital health. Our guest speaker is Ali Youssef, the Director of Medical Device and Emerging Technology Security, Henry Ford Health System. Ali, welcome to our webinar. Would you like to start by telling us about your background and how you got involved in this field?
Yeah, Greg, thank you. Thank you for having me. So my current role, as you mentioned, is the Director of Medical Device and Emerging Tech Security for Henry Ford. I've been at Henry Ford for many years now, close to 17 years, and have transitioned through different roles. And really, what brought me to this place that I'm in today was a journey that has taken me through medical device design, had a series of roles within sort of testing, product development, made my way into architecture, really mobility and digital health architecture. And then ultimately that led me down the path of cybersecurity. And so my interest in emerging tech, IoT, and medical devices really stems in an interest in mobility. When I started diving deeper into the mobility space, Wi-Fi, cellular, et cetera, there were some unique challenges that had to do with security in those areas that really caught my interest and led me down the path that I'm on today. So my role really encompasses dealing with emerging tech, so including medical devices, IoT, AI, and cloud security, and trying to balance the innovation happening in that space while keeping it secure and ensuring that we're making the best use of that type of technology in our institution for clinical care. So yeah, it's been an interesting journey and very exciting to be on the front lines in this arena.
Great. Thanks, Ali. And before we dive into our discussion, I want to express our gratitude to our valued sponsors, which include Storage System and Simplify Medical. So why don't we get started with our discussion today? Ali, I wonder if you could begin by outlining your current role at Henry Ford and identifying the primary cybersecurity challenges your organization faces.
Yeah, so as I mentioned earlier, Director of Emerging Medical Device and Emerging Tech Security, and really that encompasses many different areas, especially when we talk about emerging security. And it's an ever-changing arena. And so as far as the challenges, I think one of the unique challenges in healthcare in this space has to do with ensuring that we can continue to accommodate our legacy technology, because really the lifespan of some of these technologies that we're dealing with can be over 20 years old in some cases. So keeping up with that while at the same time embracing the future and some of the innovation happening in areas like AI, et cetera. So I think balancing that is one challenge, and really looking to make the best use of these technologies for really what is our mission, right? Clinical care and clinical outcomes. That is something that is also challenging, not putting up too many barriers for our clinicians and our providers, making sure that they can make the best use of the technology available to them. And so I think balancing that and really balancing the people, process, technology aspects, and making sure that we can encourage a sense of healthy paranoia with our end users where they're being prudent, but not necessarily paralyzed when they're looking at innovative technologies.
Great. Ali, how do you address the trade-off between cost versus the need for robust cybersecurity measures? And secondly, what strategies have proven effective in balancing these two critical aspects?
Yeah, so cost is always important, especially when you're working for a nonprofit health system. Budgets are tight. And as you've seen across the country or even internationally, a lot of health systems are really joining forces with other health systems just to survive in this space. So we're seeing larger and larger institutions. I mean, essentially, I think one of the key things to do is if you look at the number of vulnerabilities that come out on a daily basis, it's overwhelming. We cannot address every single vulnerability across the whole domain that we work in. So essentially, I think one of the key things is having a risk based approach when considering how to address some of these emerging vulnerabilities in our space. And when we talk about cost, it's important to understand that. So you have to prevent the floodgates from opening on one end. So new technologies coming into the institution have to be vetted appropriately. You have to have the appropriate policies in place to deal with that sort of thing. But then on the other end, like I mentioned, earlier, some devices we're dealing with are over 20 years old. In some cases, you've seen this in the banking industry as well. We have devices that are running legacy Microsoft, operating systems under the hood. So to the point where Microsoft does not even develop patches for these platforms. So we have to find creative ways to continue to use some of these systems while we develop a roadmap to refresh them. This isn't a scenario where we can rip and replace all of our devices that have vulnerabilities. So I think that's one of the key challenges when it comes to cost versus security. And then the other one is really understanding there's a variety of tools out there today. And in many cases, the capabilities are redundant. In some cases, you can have one tool that's doing 90% of what another tool is doing in your environment. So it's really important to, number one, do a gap analysis and understand that difference and ensure that you're using the tools that you have to their full capability before going out and purchasing, additional tools.
Are there certain tools that are considered prohibitively expensive? They may provide the right capabilities, but right now they're just not cost effective to actually deploy.
There are, and I think the key is finding that balance of sort of needs versus wants. And there are, especially in the emerging space when we're dealing with AI and some of the areas we're concerned with in that space, some of these tools are brand new and extremely expensive currently, and that price point will come down over time. Really, most of my space that I deal with outside sort of the typical IT assets, I would say the vast majority of devices I'm dealing with don't fall into that category. So we're talking, Internet of Things, medical devices, etc. They require these custom tools when you're looking to manage security with these types of devices, and the tools are expensive. They're definitely expensive tools. So we have to be very careful about evaluating and ensuring that we have the right fit. And in some cases, you have to settle for something less than a Cadillac, type scenario. Yeah. It's not the best tool, but it does 95% of what you need.
Now, you do just bring up an interesting issue about the idea of healthcare systems working together or merging. Now, if I'm not mistaken, there's been a recent merger of Henry Ford and Ascension, at least in your part of the country. What are the implications when health systems acquire other health systems in terms of standardization, in terms of those types of capabilities?
Yeah, I mean, so we do have a joint venture. I think it's public now. And it's very complex, right? You're dealing with, especially with when you start considering electronic medical records and things of that nature, the different technologies in use across the various hospitals. It's an uphill battle and a mountain to climb when you're looking at standardizing those types of things, especially because when you consider the providers and some of the workflows they're used to, in a lot of cases, they're unique to their institutions. So that element has to be considered as well. It's not just a technology conversation. It's a people and a process conversation as well.
Maybe you could dig a little bit more into more details around the operational complexities of deploying these types of emerging cybersecurity tools and solutions at scale.
Yeah, so some of what we're seeing currently, it used to be that when we look to onboard a medical device, for example, it's just that you're getting a medical device that's primarily residing on premise, in your institution. Nowadays, what's coming across my desk are really these hybrid models where it's a medical device that has a cloud component that may also have an AI component to consider. So it makes the risk assessment process a lot more complex. And in many cases, it's more than a security conversation, right? My expertise is fairly narrow.
Yeah.
So I think one of the things when it comes to operational implementation is making sure that you are involving all the appropriate stakeholders in your institution. And that may include ethicists, that may include legal, that may include clinical folks, analytics, just people that understand their area really well, where we're all part of a committee coming together and every department is bringing in their own expertise. This isn't something that is mandated by the security group. It has to be a collaborative conversation that includes input from just a cross-functional group like that.
Are there Henry Ford best practices or industry best practices, or is Henry Ford really on the leading edge, right? So where this stuff is evolving in real time?
It depends. So in some cases, the space that I work in specifically, from a cybersecurity standpoint in general, there are best practices and frameworks out there. In fact, one of the approaches that I've taken building out our programs is leveraging those as much as possible. And really, so when you look at like this cybersecurity framework, trying to align with it as much as possible in these emerging areas. But when it comes to things like AI, so in the cloud arena, I would say yes, there are some good best practices out there. In the AI space, we're really leaning on organizations like Gartner to learn more about that space and try to align with best practices. In a lot of cases, there aren't regulations out there in this space. So in the medical device space, we're beginning to see some more. The FDA has really stepped up in that space. And it's primarily they're catering to the manufacturer, not the health delivery organization. But there are nuggets we can glean off of that to understand what we need to be doing in this space. I would say the IoT space and the AI space are probably the most challenging currently because there really aren't any standards out there. It's really just different organizations publishing what they believe are best practices. And you can take what you take out of that and try to develop your program based on it.
Now, considering the evolving nature of cybersecurity threats, what proactive steps are being taken at Henry Ford to stay ahead of potential breaches?
Yeah, I mean, that's a very interesting question because if you talk to cybersecurity professionals in general, I think one of the things that you'll notice is this notion that it's not if, it's when. A lot of institutions are just waiting and expecting some form of a breach. In some cases, institutions assume that someone is already on their network. A threat actor is there and waiting, and it's just a matter of time. So I think one of the key areas is just having a defense in depth mindset where you're layering in different layers of security. So things like multi-factor authentication, low-hanging fruit like that, just making sure you have these types of things in place. And then really monitoring, trying to be as proactive as possible about monitoring and having some form of a security operations center that's ingesting all the data from the different platforms and trying their best to come up with actionable insights. So when you identify something that's high risk, we want to know about it right away. One of the other things is looking at threat feeds, participating in different organizations like HISAC and others, just so we're aware of the latest that's happening in the space. And then keeping in touch with law enforcement as well, just so we get as much of a heads up as we're able to when things are happening in this industry, especially if it's local to Michigan. And then last but not least, I think is aligning with the vendors and making sure that we understand their roadmaps so that we can figure out, do we have the best tools or do we need to look at retooling?
Can you give our audience members a visual of what this would look like? Do you guys have a war room that's staffed by 12 to 20 people that are looking at visual maps of the cybersecurity threats and what's coming in? What does it actually look like at a place like Henry Ford? And you don't have to tell us anything proprietary. I just want to get a visual on what this might be within the organization.
Yeah, so we have different partners and vendors that we deal with, and we have our own security operations center, SIM, etc. And really all the different logs are propagating to a central area, not necessarily a physical room with monitors, etc., but certainly a dedicated group of people and a dedicated set of vendors that help us keep a close eye on emerging threats. And if there are any indications of compromise in our environment, those will be brought up immediately.
Wow, thank you. Ali, what emerging technologies do you believe hold the greatest promise for enhancing cybersecurity over the next 18 to 24 months?
Yeah, so I think this is going to be a little cliche. You've probably heard it a million times, but AI, I think has a tremendous amount of promise when it comes to speed, when it comes to just automation in general. And really, a lot of the same capabilities that are helping us augment our systems and really augment healthcare in general are available to threat actors. So they're augmenting their platforms as well. They're getting faster. Phishing is getting more sophisticated. They're able to launch a multitude of attacks concurrently now. So things that used to take more time, hours and days, are taking minutes, seconds and minutes now. So I think one of the technologies that is going to be paramount for our survival in general is AI. It's essentially having our front line be empowered by AI agents that can respond to this onslaught with the same speed, because it's getting to the point where if you look at essentially trying to hire a SOC engineer today, there's a huge demand for them, but not a strong supply, and it's getting more and more difficult. I think the people part of the people process technology pyramid is getting more and more difficult in finding qualified people. So I think it's becoming really important to augment the technology aspects, which is really leaning into AI and automation.
Can
To
you
help.
bring this down a level and make this more real for audience members? Give us an example of the use of AI and what a potential threat may be, and what the automated AI agent response would be.
Sure, yeah. So essentially, one of the areas that you'll notice a lot of institutions are concerned with is phishing. Right? When you have thousands of employees and someone is hacking the human psychology basically to trick employees into clicking on links or sharing information, it's only natural that someone is going to fall for that over time. And it used to be that there were telltale signs. So there would be spelling errors, there would be things like that, maybe the email header that you could look for. And essentially that would help you determine that, okay, this is a suspicious email. Maybe I should be more careful with it. But what has happened now with generative AI is it's becoming a lot more difficult to find these things. There are no telltale signs anymore. And so threat actors will lean on Gen AI models to help to create enticing emails and really highly targeted emails where, there's a high likelihood that someone will click and share their information.
Right.
So yeah, with those types of scenarios, there are platforms in the background that are looking for that type of behavior. And essentially, as soon as they notice any kind of anomaly, whether it's someone sharing their credentials or someone using credentials or elevating credentials in a way that they're not supposed to, that's where the triggers come out, and then we can launch investigations and look into those types of scenarios.
Can you give us a couple examples of vendors that are pushing the envelope in the security realm? Not necessarily who Henry Ford is invested in, but just companies that may be good for us to keep an eye on.
Yeah, I mean, in my space, there are so many. A lot of vendors in the emerging tech space, when you look at security tools, are really looking at, you'll find that a lot of them have embraced AI and are integrating these capabilities into their tools. I don't know that I can give you specific vendor names, Greg, but I think that's the key. When you're looking at tool sets, just make sure that they're thinking about these emerging areas and it's integrated into their tools natively. You can go in and query in English what you're interested in seeing.
What key trends should healthcare organizations be prepared for to ensure that the security of their digital information systems?
Yeah, so I mean, again, I think just automation, trying to automate as much as possible, and really implementing dynamic, context-aware security platforms that can ingest data from different areas in different systems and really boil down what your team needs to do to react. That's one of the biggest challenges is a mountain of information. To find a credible threat, sometimes it's like a needle in a haystack. And sometimes you'll see high-level vulnerabilities that are classified as high priority that are not really exploitable in your environment or may not be relevant. So I think there's a lot of noise in this space, and finding a way to kind of boil that down into what's actionable will be key. Otherwise, it's an overwhelming amount of work for a security organization if you try to address every vulnerability. So I think the exploitability element is key.
In terms of your interactions with local, state, and federal organizations, as well as some of your peer organizations, other health systems who may be encountering something where in real time you guys are able to help one another.
Yes, I mean that's key, right? Organizations like HISAC, the American Health Association, have been instrumental in when there is an attack at an institution our size, whether it's in Michigan or national, they'll publish the indications of compromise quickly or as quickly as they can. In a lot of cases, organizations are secretive about these things, but I think it's becoming the norm now to share information because that's the only way really we stand a chance in this scenario. It's not an even
A last question. If you could design a cybersecurity tool with unlimited resources and cutting edge AI, what kind of tool would you create that could make the lives of IT professionals easier while keeping patient data secure? So you can put it here.
That's a good question, Greg. There are a variety of tools out there that are addressing their own sort of siloed focus. But I'd love to see if I could design a tool, it would encompass all of the emerging tech areas. So everything that falls outside of a traditional IT asset where you can deploy, antivirus in areas that you can manage centrally. I'd love to see if I were to design a tool, it would be exactly that. It would be looking at all of these emerging tech areas, and instead of treating them in silos, one pane of glass that brings all that information together. I mean, imagine you can have insight about your cloud, AI initiatives, IoT, and med devices in the same interface. That would be very, very powerful.
Maybe I've seen too many movies, but I'm imagining a war room with like a wall of analytics, right? These massive screens, and you have all the analysts on the floor taking all that data in real time. That could be more fantasy than anything else.
No, I mean, I think there are institutions that have these types of facilities, but a lot of that can be accomplished virtually now as well, especially now that a lot of the workforce is remote.
Yeah.
It makes it more difficult to staff sort of, a central area like that. But they do exist. I've definitely come across some in the past.
Well, now you've raised another thread that I didn't ask you about. What about this whole idea of remote workers? Can you just briefly tap into what are the complexities of dealing with remote workers that are part of the IT organization? And I believe you're remote as well, if I'm not mistaken.
I am remote. Yeah. And I've been remote for over a decade now. So way prior to COVID. But yeah, I mean, remote work, essentially, now you're taking what used to be a controlled environment and expanding it to hundreds or thousands of homes. So it's important to be able to delineate in every one of the homes, imagine like has its own network. And in some cases, 20 to 50 devices, right? Including gaming platforms, etc. Your kids using it for school. So that this notion, it's important that it becomes that much more important to manage the devices that are being used for work in the home. So leveraging platforms like Zscaler and others like that, where you can kind of monitor and enforce what one is allowed to do on their computer and not necessarily open it up to all the other devices that are on your networks. I think that's becoming increasingly important because really the attack surface increases exponentially. Imagine every home is like a small clinic, basically. It just becomes that much more complex to, I think, wrap your arms around it from a cybersecurity standpoint.
Great. Well, thanks, Ali. Well, Ali, thank you for sharing your time, your insights, and your perspectives today. I also want to thank our sponsors, Storage Systems and Simplified Medical, who made this conversation possible. Ali, do you have any final thoughts for the health IT professionals in our audience who are striving to implement stronger cybersecurity measures?
Yeah, I mean, I think one of the key thoughts is balancing, especially if you're in the healthcare sector, having a balanced approach to cybersecurity. So you really need to consider your business, the clinical operations, their needs, and then take that and use a risk-based approach to understand, all right, what can we do from a security standpoint to be able to facilitate? The intention is not to be a hurdle for our business. It's really to empower our business partners. So I think one of the key things I'd like to share is making sure that you're focused on that, the business itself and what their needs are, and then catering your program around that. And then I have mentioned like collaboration with different departments. I think that's also really critical. Just having, especially when you're dealing with the emerging tech space, having collaborative work groups across the organization that include clinical and other types of departments. Because when you're dealing with technology like AI, and even IoT, it's not a single-threaded conversation. This is not just a security conversation. So I think it's important to keep that in mind and just keep the mission of your organization top of mind when you're dealing with security. Because that's what we're here for, right? We don't do this for fun. It is fun for some of us, but the idea is to It's to cater to the business and empower the business and protect the business, most importantly.
Great, thanks, Emily. For audience members who are not familiar with this, Spyglass Consulting is a product and go-to-market advisory firm focused on disruptive technologies and growth opportunities within the healthcare and life sciences industries. Spyglass proudly serves more than 250 leading entities that include technology companies, management consultancies, healthcare providers, and investment organizations. We've published more than 30 market research reports on a diverse set of informatics-related topics. So to gain access to our extensive library of paid research and gain deeper insights into how technology is reshaping healthcare, I invite you to visit our website at www.spyglass-consulting.com. Well, I'd like to thank everyone for joining us today, and stay tuned for our next episode and Beyond the Blueprint. We'll continue to explore innovations in healthcare technology. And Ali, I hope you'll come back and visit us again and talk about other issues related to cybersecurity.
Thank you, Greg. I look forward to it.
Great. Thank you very much. And I think it's a wrap.
Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.